This is Dr. Anderson with North Texas Plastic Surgery, and today I'm talking to you about all things breast. So I've done multiple other videos about breast surgery that we'll link to below. Today we're more focusing on preparation. So I'm not necessarily going to go into the ins and outs of every breast procedure, but this is more going to talk about as we're getting ready for surgery, kind of going through the process and recovery, how to set yourself up for the most success. You've gotten to this video, so we assume there's something regarding your breast that's not quite what you're wanting to see, and you're ready to get a little more serious about talking to somebody about it. So the easiest thing for you to do is head on over to our website that we'll link below, and you'll quickly get directed to be able to fill out some information so you can talk with somebody on the team. They're going to help determine the most likely procedure that's going to get you to where you want to be. Then what's going to happen is we're going to get you ready to set up for a consult. So for specifically breast procedure, there's not going to be too much that we need to do specifically in preparation for the consult itself. Though if we're thinking holistically, if we're doing some sort of lift, reduction, lift with implant, anything that's going to involve a lift of the breast, I do like you to be relatively close to what you're going to feel like your ideal body weight is. And I'll tell you that day of consult, like within about 20 pounds is where we're going to be. And the reason for that is I don't want to have you go through this whole process of surgery that's very time intensive, it's expensive, all of that. We go through it, then you have this real significant body change and your result ends up not being very good. So if we're in that roughly 20-pound range of where you'd like to be, we're helping ensure beforehand that we're having the highest likelihood of getting you a result that lasts for a really long time that you're really happy with. The way the consult's going to work, you'll show up at the office, you'll fill out any paperwork that may be remaining, and then you'll get roomed with my nurse. The reason that's going to happen is she's going to talk to you first about kind of what you're hoping for and figure out the exact right procedure or the probable exact right procedure. If there's going to be an implant, we can try on some sizers to determine a range that you're likely most going to be happy with. And it's just a little bit easier to have that conversation with her rather than me come in and just like be intimidating or something like that. That's not my goal, of course, but I know that sometimes it happens. So anyways, it's a little bit disarming with the nurse, get a little bit comfortable. Then she's gonna come talk to me and I'm gonna make your 3D images of whatever procedure it is we've decided on, or you've decided on, where we wanna be like 3 to 6 months down the road. Then I'll come in, we'll go over everything, anything medical we need to talk about, confirm that that's the right procedure for you. You can talk about any of the implant stuff that you want to know if we're going to do an implant, or some of the logistics if we're doing a lift, whatever that may be. And then we'll go over that imaging to kind of ensure that that's looking relatively close to what you have in your mind's eye of where you'd like to end up several months down the road once things are healed and settled. It's going to be important for us as well at that point in time to go over expectations that you have with surgery. And I'll be very frank with you what I think I can accomplish, and if you're asking for something that I don't think I can accomplish. Because honestly, it'd be a really big shame, and we just don't want to have you going into surgery expecting something that's not realistic. Now, that would be honestly pretty unexpected. The vast majority of people that come to see me are very reasonable and kind of have a reasonable idea of what they want. And I have been pretty successful with being able to deliver that. So don't worry about that too much, but we're going to make sure of it. What we're talking about as far as breast surgery is totally elective surgery. This is not surgery you have to have. So my philosophy here is, if we're going to do this, we have to go into it being absolutely as safe as possible. So depending on your medical history and what procedure we're going to do, that will help us determine what we need to get before surgery to help ensure that safety. So whether that's a visit with your primary doctor, lab work, EKG, any combination of those things, if you need that to ensure your safety, we're going to get that beforehand, again, so that we can get through surgery with the least likelihood of complications as possible. One of the things that surprises some people when it comes to what they think of as being a relatively simple surgery is the number of medications that I prescribed you for after. So there's several different pain medicines, and the reason for that is each one of those works slightly differently on different pain receptors, so that when you take it in combination, you can actually take less overall and have a more comfortable recovery process. Part of that too is we always like to decrease the amount of narcotics that you're needing, just because they have a tendency to make you so constipated and can make you really uncomfortable. In addition, you're going to take an antibiotic right after to help suppress any of those little skin bacteria that just happen to be around. And if there's an implant, I'll have you take another medication that helps the capsule around the implant stay soft and supple so that the implant looks as good as possible. As far as anesthesia considerations, I always do my breast procedures under general anesthesia. For me, it allows you to have a much more comfortable surgery. It allows me as well to manipulate your tissues in a way that's easier, safer, decreases blood loss, and keeps you safer. So I understand that hearing general anesthesia is kind of scary. The anesthesiologist will kind of jokingly tell you it's technically safer to have anesthesia and have your surgery than drive to the surgery center. So I get it, it's a little bit freaky, but it's something that we do every day, and we do all of these things to ensure your safety. Now we'll go into some of the practical considerations after surgery. So one thing that people always ask is time off work. So for a breast procedure, the discomfort after surgery tends to not be that high. A lot of people take only a few days worth of the strong pain pills and are really feeling pretty great at about a week. Some people recover faster, some people recover slower. So I'll generally tell folks about a week to 10 days to being back to work is a pretty safe time frame, unless you're having to do something that's quite rigorous that requires lifting, pushing, or pulling more than like 10 pounds. We may need a little bit more time off work, or I'm happy to fill out if they have like light duty at that job, because we do obviously want you to get back to work as fast as possible. As far as home setup, there's not too much that you need specific for this. I do ask that you try to sleep on an incline for the first couple of weeks after surgery. That's as simple as a couple of pillows behind your back. If you have a reclining chair, that's easy. If you have one of those adjustable beds, that's probably the easiest of all. That's just not that many people. As far as post-surgery care, there's going to be skin glue over all of your incisions. So there's not going to be, honestly, a ton of care that you have to do. You'll be able to shower at 48 hours and soapy water can just run over all the incisions. I ask that you not scrub anything. We just want to let that glue fall off on its own, and that's usually around the 3 to 4 week mark that happens. I will have you in a post-surgical bra right after. There's not too much that's really special about that bra, honestly, other than there's no underwire and it clasps in the front. Just especially if we've done an implant, trying to move your arms behind can be kind of uncomfortable. So having one that clasps in the front is just less cumbersome and more comfortable for you. One of the other aspects that sometimes people will ask related to breast surgery is breastfeeding. So if we are doing a breast augmentation and no sort of lift, the way I do my dissection is I make an incision underneath the breast, and I'm under all of the breast tissue and under the pec muscle itself. So there's really nothing there that would interrupt breastfeeding. That being said, every woman who wants to breastfeed isn't necessarily able. I can't tell you for sure that you will or will not be able to, but as far as a straightforward breast augmentation by itself, there's nothing that we've done together that should interrupt that. Now, if we're doing anything that's involving a breast lift, I do leave a fair amount of the breast tissue attached to the nipple and areola itself. So there is potential there, but some of the breast tissue is removed, and then some of the areola tissue is removed. So the likelihood that you're going to be able to successfully breastfeed is decreased. I can't tell you an exact percentage. They've tried to study it really well in the plastic surgery literature. And like I was just talking about, there's too much variability in the possibility of you just not even being able to breastfeed from baseline that I can't give you that exact number. What I will always tell people, and this becomes especially poignant in my younger teenage patients that just their breasts came in way too huge and it's totally affecting their quality of life. We just have to have an understanding going into surgery that if we're doing some sort of lift, breastfeeding may not happen. So if you're a person who feels like, breastfeeding is going to be very magical, intimate experience with your child and you can't possibly think of doing something to interrupt that, we may need to wait until those years are over and then we can do something afterward. Fortunately, I don't see too many complications after any of the breast surgeries that I do, but I'll be very honest, I do a lot of breast surgeries, so they definitely can and do happen. Now, the even more fortunate part is when they do happen, they tend to be minor and not cause long-term problems. If we've done anything that involves a breast lift, the vast majority of people will have an intersecting incision on the undersurface of the breast. So there's an incision below and an incision here. Where those come together, we call that the T-point. It's not unheard of that a stitch pops through or we get a little bit of skin separation there. This can be super stressful for you as the patient to see something not go totally perfectly, but we're going to be in a lot of contact about this. The vast majority of times we keep things clean and dry and maybe put a little bit of antibiotic ointment on there. It heals up really quickly and just becomes a part of the scar that we don't even notice that anything was there long term. Now, I do tell folks, if that scar isn't as beautiful as we want to be after everything's healed 3 to 6 months down the road, we can always do a little touch-up revision in the office. But honestly, the number of people that take me up on that is super, super low. But I'm here to take care of you in case your results aren't just as perfect as we can make them. The other common, it's not common, but as far as complications are concerned, thing that we would see is if you have an implant, if one implant decides it's going to settle higher or lower than the other side. Now, almost always, these things fix themselves if we're patient. So it's really common to come in a week after surgery and be like, oh my gosh, my right boob is higher than my left boob. And it's like, that's okay. Everybody's anatomy is slightly different from side to side, so it just takes a little bit longer for one side to settle. If we've been patient, we waited 3 months and it's still not quite right, we will do a revision procedure if you desire. This one, little bit more annoying because to do it safely, we do have to go back to the operating room. It's hard to give you all the exact details around that, but I can tell you when you come in, you talk with Bedia, she has the revision policy so you can know going in that you are taken care of. Again, it's not something we plan on, but I think all of us live in the real world and we understand that things can happen. And I think it's nice to know, even before you come in and see me for consult, that I'll take care of you if something does happen long term. And this has been Dr. Anderson with North Texas Plastic Surgery. If you liked this content, please like, comment, subscribe below, and check across all social platforms. We're posting it there too.